Hi everyone, this is Farah, your interviewer for today, and I'm here at Health 2.0 Conference Dubai, and I have here with me Mr. Andrew. How are you?
I'm very well, thank you. I'm very happy to be here. Thanks for the invitation.
Of
It's great.
course. Yeah, pleasure to have you here. Can you please introduce yourself and your organization?
Sure. Well, so I'm Andrew Norris. I'm a anesthesiologist by background, and I'm currently the chairman of anesthesiology at the King Faisal Specialist Hospital in Riyadh, which is Saudi Arabia's probably main tertiary referral hospital. Super busy, highly operational, lots of complex work under one roof. Really exciting place to work, and that's been a great opportunity, and to bring that here as well. It's been
Of course.
good. Thank you.
So, first of all, I'd like to congratulate you for winning the Outstanding Leadership Award.
Right. Thank
How
you.
does it feel to receive this kind of recognition?
Well, I mean, it was a bit of a surprise, to be honest, and of course, it's always nice to get something. And I think I've had quite a sort of a varied kind of career in the sense that I did a lot of clinical work, but my main focus for many years was really postgraduate medical education. So I did a lot of that and had a number of roles in there. But over the years, I've sort of done a little bit more clinical research and translational research, as particularly with the engineering faculty in Nottingham. And we're continuing to do that and to collaborate with King Faisal and probably other institutions in Saudi Arabia going forwards. And I think because I've been a little bit of a dabbler in different places, I haven't perhaps, it's a little bit novel for me to get a recognition like this because it spans different disciplines. So, yeah.
Well, can you tell us more about your experience in this industry and just how do you think that this industry is changing lives?
Well, I mean, I think medicine obviously always changes lives. Hopefully
Yeah.
for the better. I think medicine and healthcare are facing, very, very big, or probably existential challenges at the moment. I think although we're continuously, kind of discovering innovative technologies, personalized healthcare, genomics, all these sorts of things. Many of these cutting edge developments, which are capable of making a huge difference to people, especially to individual people, those things are coming at very significant cost. So the costs of delivering state-of-the-art healthcare is spiraling really out of control, even for very developed societies. That's number one. It's been, I mean, I've been practicing clinician for 35 years or so, and over that period of time, in one professional lifetime, I've seen a very big difference in the nature of patients, how they present to us. They present much older with chronic disease management. Expectations have changed very substantially. So, there's huge challenges, people in the workplace, finding the workforce. So we need, along with the amount of care that we're providing and the complexity of that care means the number of people we need to deliver it and the skills they need, are expanding, and there's a finite number of people around available to do that. So that's a massive issue. I don't know, but there are some things I think on the horizon that may help. One of them is absolutely we've really got to get a grip on this kind of lifestyle well-being type stuff. So Saudi Arabia, for example, where I now work, has got a huge obesity, diabetes type problem, hypertension. They've got all these kind of Western medicine issues. And if we contrast that with, there are places on the planet where, you just don't see that. And that is largely, or, very largely, kind of lifestyle access to, exercise and diet and life choices. So that's a huge opportunity if we can get it right. And we know the science, it's about implementing the change. I think that's one thing. I think there are, God knows really what the opportunities are around the whole AI space.
Right.
But I think, there are definitely opportunities there in terms of self-care, in terms of acting as an aid for physicians in kind of, diagnosis and keeping up to date. I mean, we've been talking for, getting on for 60 years or more about how impossible it is for physicians to stay up to date. Well, and, now we have tools that will help us to do that. So that's, I think, exciting. Also robotic developments as well, I think. Some stuff around pharma where I think, I alluded to it a little bit earlier on, but things like, the genomic medicine, the targeted therapies, if we can find ways of delivering those in a less costly way, that's really going to be transformative. So I think the AI stuff, I think the personalized pharmacy piece would be, right up there, as well as actually somehow managing to get some traction on the well-being. I think those would be the straws that I would hang on to and try and drag us through the next 50 years or so.
Yeah, AI is definitely a very big area that needs to be explored yet, and hopefully it can be used in a good way in the health industry.
Yes, I think there obviously are issues and threats around there, not least to kind of people's jobs and things, and misinformation and poor information and so on. But I think, for me, that those adverse issues are far outweighed by the potential advantages. I'll tell you a little story, if I may, if we've got time. But so a few years ago, I had a very, very bright young bachelor's student who was working with me. She was doing a B.Med Sci as part of her medical degree. And we did a piece of work, it was a very early piece of work, where we were trying to use computer vision technology to observe what clinicians were doing in the workplace. Right now, we started it in the simulated workplace, and we started it with medical students because we thought that would be easier. And we set up some scenarios which, I've been doing medicine for a very long time. So I was looking at them doing this scenario thinking, this is so uber basic. How can this possibly go wrong? And yet the students were really struggling with it. And simultaneously, Carrie and I both looked at each other and said, what these guys need is they need R2D2 at the bedside who says, well, guys, the top 3 things this is likely to be are bang, 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 right? And why don't you ask these questions or something, right? So I think, decision support, access to, the kind of up-to-date information could be, really helpful for clinicians. And then it just leaves, the clinician and the patient. Now we can carve out all this business about how much we know because we know everything, essentially. Yeah. So now we can just have a conversation about, well, what do you want to do? What's important to you? What can out of these options, what can I deliver in this institution? So we can have a human discussion and leave all this technical stuff to the bots.
Yeah, of course. I honestly see that how helpful it can be in the future. And so hopefully that will be the case.
I hope so, yeah.
Can you tell me about your experience at the conference so far? Did you network with a lot of people here?
Well, I'm just warming up. So we're kind of come to the end of the first morning on the first day. And I think, as quite a few other people have commented on, the novelty is, that you've got people from different walks of life. So we've got a reasonable number of clinicians, actually slightly more than I thought you might. But also, people from policy and finance and, engineering and IT and all kinds of things. So I think that's quite a fertile environment. I suppose in theory, you worry that, we don't overlap enough to have effective kind of traction on each other. But that doesn't seem to be an issue. So, I've already met, some interesting folk, and I'm definitely looking forward to, to doing more of that. I've got a keynote tomorrow. Well, thank you. I don't know, the organizers seem to think it might be of interest. So I'll try to not have it too dry.
No, well, I hope it goes well.
Yeah,
and hopefully you'll have an incredible second and third day as well.
I hope so. Thank you.
Thank you so much for being here.
No, you're most welcome, and thanks for the invitation.
Congratulations again.
Oh, my pleasure. Thank you.
Thank you.